Good morning and welcome to the 2021 Illinois Suicide Prevention Summit. My name is Matt Davis, and I'm so pleased to have the privilege to welcome all of you virtually to Chicago and to Anna Robert H. Lurie Children's Hospital, and also to the academic campus of the Northwestern University Feinberg School of Medicine. I am the chair of the Department of Pediatrics here, and also a professor of medicine, medical social sciences, and preventive medicine. I also have the honor of leading our Patrick M. Magoon Institute for Healthy Communities at Lurie Children's, which is focused on engaging and working with community partners in order to be as responsive as possible to community health needs and to work toward health equity in all aspects. I am delighted to welcome over 800 individuals who plan to attend our summit today and tomorrow, certainly from across all of Illinois and also from coast to coast across the United States. In total, those of you attending represent over 440 unique organizations, including hospitals and health systems, clinicians in private practice, university and school districts, public health departments, police departments and departments of corrections, probations, court systems, attorneys' general offices, and nonprofit support and advocacy organizations focused on mental health and suicide prevention. Specific to this summit, I have the great pleasure of serving as the founding director of the TRICAM initiative at Lurie Children's Hospitals. TRICAM stands for Teamwork to Reduce Infant, Child, and Adolescent Mortality, and it is a program that is dedicated to fostering and facilitating new ways to address the leading causes of mortality for the youngest residents of our city, our state, and our nation. I'm a primary care doctor for children and adults, and I've been in practice for nearly a quarter century. I've experienced the extraordinary importance of listening to and understanding the interwoven stories of physical and mental health, and I've tried my best to address my patients' behavioral health needs in my clinic. I've also witnessed how difficult it can be for patients to get access to timely mental health specialty care, depending on where they live and what their insurance coverage is. And yes, over my career, I have also experienced situations where patients have attempted suicide and situations where patients have completed suicide. These experiences and these stories of the patients who have benefited from support, from preventive outreach, and from therapy, and also those who have not, drive me to do more about suicide prevention. And I know that those stories drive those of you attending this summit as well. We must do more to prevent suicide among the populations we serve. And we must do more not only in healthcare settings, but also in neighborhood settings where we can try to have a positive impact farther upstream. We must do more in our juvenile justice and criminal justice systems, where so many individuals in mental health crisis initially interact with our systems that can potentially support them. We must do more in our educational systems, where the building blocks for positive self-regard, positive peer relationships, and positive self-care can be established and nurtured as part of social-emotional learning. And we must do more in community supports for adults more generally, who are facing extraordinary strains related to their emotional well-being and may not be able to readily access support. In all of these settings, we must be mindful of health equity across sex, gender, race, ethnicity, income, religion, sexuality, ability, veteran status, citizenship, country of origin, language, and other personal characteristics that can potentially bias our services if we fail to address those biases. At this summit, it's important to note that we have a new Illinois strategic plan for suicide prevention. This is an important step for many reasons, not the least because this is the first state plan that Illinois has had of this kind. I extend my gratitude to those of you in attendance who contributed to the formulation of this plan. Thank you for paving our way forward. Before I wrap up my introduction, let me just express my appreciation for the multi-organization team that has made this summit possible, even in the midst of a pandemic. Their efforts are a true testament to what can be accomplished through collegial, forward-thinking partnerships. I will say more specific words of thanks in my closing remarks tomorrow, and I also look forward to addressing you during the Day 2 keynote tomorrow at 12:30 Central Time. It is now my pleasure to introduce our first speaker, Dr. Michael Hogan, who will provide the Day 1 keynote. Dr. Hogan has a wealth of experience in mental health, but most recently has become a compelling advocate for the zero suicide movement for healthcare that you'll be hearing much more about during his remarks and also other presentations during this summit. Among his various activities, Dr. Hogan has been a member of the National Action Alliance for Suicide Prevention since it was created in 2010 and has co-chaired task forces on clinical care and interventions as well as crisis care. Dr. Hogan, welcome, and the floor is yours.